Hello everyone, this is Dr. Anam Zahir from Homoeopathy Heals. A very happy new year, and I hope you all are keeping well, you all are happy, joyful, with no grudges, doing well in your personal and professional lives. Today we are having the first session of 2022, and I hope you are taking good care of your health and wearing proper mask and shields at your practice. This is my request to all the patients, neighbors, friends, those who want to consult. Call or text your doctor first. If your follow-up or consultation is possible online, you better reach out to your doctor. Your doctor will get your medicines delivered at your doorstep. Maintain social distancing. Although this third wave the infection is mild, just sore throat, not that high grade fever or loss of smell, but that doesn't mean we don't know about the consequences. So better you stay home and stay safe. So today's guest talk is very special, and with the new year we'll start with a new fresh start. In this session we'll be learning how to grow our practice and how we can evolve our learning and our knowledge this year, because I also have a lot of books and I feel like I should study them, but what to study, how to study, and how to be persistent. Eventually हम इंसान हैं, and we lose the string पढ़ाई करने का. तो आज का सेशन जो लोग भी देखेंगे, आई एम श्योर उनका आगे आने वाला पूरा साल किताबों के साथ और अच्छी प्रैक्टिस के साथ गुजरने वाला है. विदाउट वेस्टिंग एनी मिनट, आई वुड लाइक टू ऐड आवर गेस्ट. Our guest will be here any minute. Hello all those who are joining. I hope you are ready with your all questions regarding your practice and studies. So this session will be useful from first BHMS to even practitioners like me. So please join the live. Or sir, you can send me the request to be in the live. I can accept that. साल नया आ गया है. Adya Singh is asking BHMS is what? See, I have answered this question multiple times. It's not just about the BHMS. Even it's about business, service, social service, entrepreneurs, self-employment, whatever you do, everything. If you are skilled enough, if you have that marketing techniques, if your the motive is for the benefit of the society and the people, common people, definitely it is important.
Hi, good morning, Dr. Anand.
Yes. So a warm welcome to you. I'm very happy.
Thank you so much. Thank you.
I'm so glad you are here for the first session of 2022.
I'm glad to. Thank you for inviting me. Thank you.
I'm getting eager.
There's a lot of disturbance. Just a second, I'll turn my phone. Is it fine now?
Perfect. So before we start, I would like to introduce you the guest of honor today. He is none other than your favorite, my favorite, our favorite, Dr. Vansh. He's a homeopathic consultant practicing in Aurangabad, Maharashtra, and he's a state level ranker and proud alumni of MD Homeopathy of Dr. M.L. Dhavle Memorial Homeopathic Institute, Palghar. He is National Chinmay Sagar COVID Warrior 2021 awardee for dedicated service to various COVID centers for 8 long months without a day off. He is mentor by choice to many students across the country, and every weekend he dedicates the problem solving sessions for students and practitioners. He's an avid reader, as I'm sure most of you must be knowing that he has a huge library and he has a sound ground over philosophy. He believes in uplifting colleagues and fellow practitioners by not just sending books on their birthdays but gifting them the stickers and promoting their business as well. He is a blend of multiple schools of thoughts and gurus, and he's also key speaker of so many workshops, be it ECG or cardiac cases in homeopathy. Above all, he is the person who is very much close to so many stalwarts, and he has a brutal, honest views which may surprise you. Again, a very warm welcome to you, Dr.
Thank you, ma'am. Thank you so much.
So, without wasting time, we all are very much excited. Dear audience,
Yeah,
students, practitioners, drop your questions, fire him. He'll be very much ready with his honest answers, whatever you want to ask. Okay, so my first
yeah.
question is, first you tell me about how you start your practice, your actual startup. And जब आपकी practice शुरू हुई, who were your first patients? आपने किस तरह के patients से देखना शुरुआत?
Okay, okay. The thing is, when this question comes, when you started your practice, I really have to pinch myself back and I have to recall who were my first patients. It's not the day when you put on a banner and sit on a commercial location and you start practicing. That is just for the people you are open, for the public you are open. Your actual practice starts the day your parents start asking medicines from you. For example, I'll tell you, my dad by qualification is a uh, D farm. So since childhood, I have been seeing if any complaint any one of us at home is having, he used to pop up some medicines and he used to give us allopathy. So since the day I got admitted into BHMS, I wanted to change this trend in my home itself. Very first thing, and gradually within first few months of my BSMS, this thing happened. For any complaints, no, my mom used to ask me कि तेरे पास कुछ medicine है तो तू दे, homeopathy दे. So that was something that triggered me. I had to, whatever little I knew at that time, I used to take the details, study, ask my colleagues, ask my seniors कि क्या दूँ, कहाँ से पढूं. And then this trend slowly changed. एंड आई एम वेरी हैप्पी एंड आई एम वेरी ग्लैड कि जहाँ पे हर छोटी चीज के लिए घर में एलोपैथी ली जाती थी हमारे घर में, दैट ट्रेंड हैज कंप्लीटली स्टॉप्ड नाउ. सो दिस इज वेयर योर first boost, first motivation, what you say, to practice homeopathy starts. It comes in your family members, your blood relations start asking medicine from you. That is the day when you start practice, and this happened long back for me, around since 2010, I have to say that. Yeah, officially I've been practicing like since 2 years now, like sitting in a proper place and practicing, but I've been learning, prescribing, doing home consultations, everything since past 7 or 8 years now.
That's so good.
Yeah, doctor.
Even my mother is not fond of, popping pills. And even
uh,
though when I know, okay, you need to take modern medicine and then it's fine, then she also says, Are, you're MD in homeopathy. How are you asking me to take paracetamol when I'm having a slight fever? I was like, that's okay to take a paracetamol and a slight fever. You don't have any other symptoms. Take
yeah,
paracetamol and sleep. So she's like, no, you give me homeopathy. Homeopathy suits me. So I can understand that,
exactly.
culture in the family. Okay.
Yeah.
So
Yeah.
my next question is to you, boss. How your journey started, and how you I have seen hundreds of pictures of you with your gurus and so many stalwarts of homeopathy. So how you have chosen your guru and why guru is important?
Yeah, yeah. uh, First thing, I came into this field accidentally. There was no plan as such कि I have to become a homeopathy doctor. My first plan was I was going for toxicology and forensics. I was going for, and some issues happened with the admission process. I pulled my leg out and I got myself admitted in BHMS. So in the very initial days, I didn't know what it was. I started Googling like anyone else would do, and this built up my curiosity. I came across a video of Dr. Praful Vijayakar sir, where he was talking about treating a blind child who was, congenitally born blind. And that was something that triggered me a lot कि अच्छा ऐसा कुछ होता है होम्योपैथी में कि you can bring a vision to someone. I started searching for people. I started searching for big people who are eager to share their knowledge through seminars or let you sit in their cabin and let you take the case. So my journey began over there. My UG teacher, Dr. Praveen Bidkar, was one of the key persons who introduced me to the other song and the Shankaran school thing. So since 2010, I've been accompanied by him everywhere. He gave me a lot of exposure कि इधर से ये सीखने का, इधर से ये सीखने का. And for me, that kind of guru who is so selfless, who is guiding you freehand, ki theek hai, you have this passion in you, you have this curiosity in you, let me feed you what is right for you. From there, this thing started. After that, with that growing interest, I said कि अगर मैं मेरे को सीखना है तो I have to go to homeopathy practitioner to a clinic. There was another person, Dr. Manoj Nagori, who is the senior most practitioner of Aurangabad, who doesn't keeps any students, and he's one of the strict teachers की जिनके सामने खड़े रह के भी you'll tremble, that kind of person. I sat with that man for almost 3.5 4 years. He literally taught me to read materia, ऐसे finger रख के on your Allen's keynote, and he used to literally record those things. What I used to, he used to ask me to जोर से बात कर क्योंकि record हो रहा है. And when he used to walk in the evening, he used to listen to all those recordings क्योंकि उनको पढ़ने के लिए time नहीं रहता था. These were the people who triggered you. Lastly, there is one more person, Dr. Mahesh Sakla, who has been mentoring me since I came into BHMS. He never allowed me to sit into his clinic because his level of knowledge was something else. Because he knew कि ये बाजू बैठेगा तो ये distract हो जाएगा, इसको कुछ नहीं समझेगा. But he kept me a moral support of how to set up, where to set up, what to charge, यहाँ तक की चीजें, कहाँ से medicine मंगाना है. All these guidances, no, which comes over experience of years. वो मेरे को ऐसा फ्री हैंड ऐसा सर्व्ड मिला ऑन द प्लेट. तो या यू जस्ट हैव टू स्टिक टू द राइट पर्सन. एंड या गुरु इज important. Without guru you are nothing. It's not that you just have to stick to just one guru. You can go on learning from as many people as you can, because out of their whole experience you get the cream of whatever they have earned in so many years. So as much as you can gain from anyone, no, selflessly, खुद का service देने का, dedicate yourself. You do multiple intentions. Don't expect for money, don't expect for stipend, don't put a time limitation bar कि मैं 12 बजे तक ही काम करेगा, रात को 9 बजे तक के बाद में नहीं रुकेगा. It has happened. मैं 102 फीवर में था and my first salary came from नागोरी सर का clinic where I was assisting him. 102 के फीवर में बैठ के मैंने डिटेल्स लिया था and he didn't knew I had a fever. उनको जब पता चला उन्होंने मेरे को भगा दिया एक हफ्ता. So yeah, you have to dedicate yourself.
Okay. My next question is, boss, हम लोग BCMS में एडमिशन लेते हैं तो we have a syllabus of first year, second year, third year, different books,
Yeah.
और बहुत सारे स्टूडेंट्स ऐसे जिनके पास थोड़ी चंद किताबें ही होती है. कुछ स्टेट्स में ऐसा कल्चर है कि some are practicing over just Pathak poetry, some are just practicing over Allen keynote.
Yeah.
है ना? So since I know you since 2 years, you have added so much in my literature, in my library as well. What do you think? How much literature is enough? एक होम्योपैथ के लिए कितने बुक्स होने चाहिए? और इसके साथ एक और क्वेश्चन मैं ऐड करूंगी. मैं पढ़ पढ़ के भूल जाती हूँ. इवन दो मैं पढ़ाई करती हूँ, मुझे किताब में खत्म कर देती हूँ, मैं बुक का रिव्यू भी लिखती हूँ, लेकिन unable to retain it. तो आपके पास ऐसा कोई फंडा है? I'm reading something new, or even if I'm reading something old, the source book, Allen keynote या class material America, so am I able to retain it? आपका count क्या है?
Okay, I'll answer that to you in two steps. मेरा charging कम हो रहा है. Just give me a second. I'm adjusting it. Yeah. Yeah. To answer that, I'll answer that in two different ways. Your first question is how much literature is enough for a student, right? If someone is a student who is in BHMS doing his undergrad, already he has to go through all the allied subjects, around 14 to 15 books, right? You have to understand this one thing: for what purpose we are reading or studying. That is where the main question comes in. If you want to just pass for exams, that is your goal, that is your aim, Then you get shortcut guides in the market, you study them, give your exam, forget it, and leave, right? But it is something, if you are looking as an asset, asset is something that gives you wealth and prosperity over a longer period of time. If you see to books in that sense, then your question gets answered. There is no limit कि कितना books पढ़ना चाहिए. For undergraduate, if you are curious enough to know and study and read about homeopathy, there are some specific literatures which will clear off your base, clear off your concepts, which is very important. I feel more than retaining materia medica and drugs and repertory chapters in your head, the student should focus on clearing their concepts about homeopathy, and there are certain specific literatures which talk about it. Okay? Just for an example, I'll show you this literature. This book is Principles and Practice of Homeopathy by Dr. Emil Dhove, right? This book is a complete gem and a complete package. I'm not promoting this book. I'm not saying ki go and purchase this book. This is what I read for myself since 2010 or 11. And this book talks about everything from case taking, from repertorization, from concept point of view. Ki once you go through such kind of literature which are authentic, which give you the right information, it doesn't talks about कि ये remedy आ गया तो game is done. No, coming to a remedy is a half thing. After you prescribe a remedy, what you have to do, that all things this thing covers. So this is one of the authentic literatures which talks about concepts, which clears your concepts as a homeopath, right? That is the first thing. Whatever is in your BHMS syllabus, obviously you don't have an escape out of it. You have to read it, go through it, because you have to pass the exam and qualify also. My thing is, if you really want to gain something, you have to read for knowledge. You should have that your own thirst. You have to cultivate your own thirst for knowledge, and your thirst will decide how much quantity of literature is useful for you. Right? Apart from this, second part I'll answer. Same thing for a practitioner who is a new practitioner who is practicing since 10 years, 20 years, whatever. Having said that, talking about concepts and having a clear base, now when you are done with having a sound ground on which you can practice, then you should expose yourself to certain literature as such, where you get to learn from the experience of the stalwarts, which you don't get into your regular reading, right? One of the another books that I'll talk about is this book, Clinical Experience of 70 Years by Dr. S.P. Kupikar. You know, this book again talks about a lot of questions a practitioner would face while taking a case, while taking a follow-up, when certain remedies don't help him. This book gives a lot of backing. It even talks about the simple question ki how much fees a new practitioner should charge. इतना बेसिक चीज के बारे में बात किया हुआ है. So as you grow, as your maturity level grows, as you go on reading things and absorbing things, the kind of literature you have to upgrade yourself with that. You cannot just stick on just one book or one literature and be rigid ki lifelong में ये 40 remedies में काम करेगा. नहीं, that is not good. Yeah, over to you.
I'll tell you about this book and I'll tell all the viewers. As I've told also, I've got this book as my birthday present from Dr. Vansh, and I started this, although I'm just halfway through it, but it's such a lovely book. It even tells the duties of a homeopath student. What are my duties? What are my responsibilities? And how can I practice legally? And apart from that, if they have discussed a case of simple gastralgia or acidity, they have given wide clinical comparative materia medica for that. Why the author has selected pulsatilla, not antiprurite, and why he has not prescribed Nux for that. So that's the beauty of the book. This is the must-have book. And I promise you, Dr. Vansh, I'll complete it this January 2022. By anyhow, but I'll complete it.
Great. My purpose is served.
Coming back to the questions, but you cannot escape from my questions.
Yeah.
Now, my next question is, you told about that there are, a continue upgrading of books, है ना? जैसे जैसे year बढ़ रहा है, BHMS का books बदल रहे हैं. प्रैक्टिस को
Yeah.
टाइम हुआ, बुक्स पढ़ सकते हैं। आपके अकॉर्डिंग बुक रिकमेंडेशंस क्या होने चाहिए आपके हिसाब से? किस लेवल पर आके होम्योपैथ्स को कौन सी बुक्स पढ़नी चाहिए, किस तरह की बुक्स पढ़नी चाहिए?
Okay. I'm too young to answer this question, but I have a lot of literature to talk about because I go through all of those things. I get benefited. My patients get benefited out of it. So again, I'll answer to you in two parts. Okay. I feel there are certain books that are basic, जिसका compulsory reading होना चाहिए. I feel so. Not only for clearing your concepts or gaining material medical knowledge. No. What happens is once you are totally into homeopathy, when you are curious to learn about homeopathy, no, it's like an ocean. It's like a vast ocean. Although we have books from hundreds of authors from past 200 years, a lot of the literature has been out of print now. Okay? The value of the book is not what the price which is written on the backside of it. If you read a literature, be it 4 pages short, 400 pages long, if you're even able to practice and prescribe and give certain remedy to a patient out of that knowledge, book का खर्चा वसूल हो गया. So first thing first, for basics, for the UG, along with whatever you are being given a target to pass BHMS, don't just stick to SK Dubey. Dubey is a good book. Dubey is a authentic book where all of us have read it and passed our BHMS and crack materia medica. But if you have to gain that thing, no, I'll give a task to all of the people who are watching over here over today. And I wish even if one person sticks to that task for the whole year, my purpose is served. The very first thing, everyone knows this thing. This is not new what I'm talking. This is something that you should get yourself completely read, at least one reading in whole of your 5.5 years period, in the BHMS period, the Allen's keynote. And secondly, whatever is there in Allen's keynote, same should be done from this book, Boric. Everyone knows this, but no one does it. The thing is, you get dry with reading of these things because things are repetitive. You get things that are common and you get confused कि कहाँ पे क्या लिखा है. You get confused because you think कि है ना ये एग्जाम के लिए अपने को लिखने का. You don't think from the purpose of knowledge. That is a problem over. So for UG people, I really feel there are certain literatures one should stand strong upon. For materia, these two are more than enough. And even after this, because in UG you have a lot of time period, you have a lot of span, you can spend a lot of time on reading and gaining things. From materia point of view, one reading of these books should be compulsory done. First is Leaders in Homeopathic Therapeutics by E.B. Nash. Second, Boric, I told you. Third, Allen Keynote. Fourth, because you have a lot of time, one complete reading of Kent's lecture on Materia Medica is a must. Because what happens? Can I elaborate this point, please? I'll take a few moments. What happens when you read about the burning of sulfur in Kent? So maybe for 5, 6 or 7 pages, he'll go on elaborating कि है ना burning of sulfur कैसा रहता है. You might get bored, but you'll understand its value once you read the same sulfur from leaders in sulfur from Nash, जो कि पूरा एक अलग book है Nash का, Leaders in Prescribing Sulfur. You understand कि है ना what all things that person has wrote in 8 pages on just simple one symptom burning is been elaborated well in specific areas by Nash. When you read the same thing by Tyler, Drug Pictures by Tyler, you understand कि वो सल्फर के बर्निंग के ऊपर अलग अलग स्टॉलवर्ट ने क्या क्या कमेंट किया है. And when you go on further with this thing, when you come on to Borik and Patak, you understand it has become more concise and precise, and it is been quoted in between the clinical experiences by them. All the pathological symptoms where you see the burning. When you come down to Allen Keynote and you read the burning symptom of sulfur in just 2 or 3 lines, you understand कि अच्छा वो 7-8 पेज का burning ना इसने 3 ही सेंटेंस में लिखा है. And at the end, when you go to Boger synoptic key, you just see just one single word. either oversensitiveness or cosmopolitan or burning. When you read that one single word, no, you have the whole story in your head कि अच्छा Kent ने ऐसा बोला, इसने ऐसा बोला, इसने ऐसा बोला, तो बोगर में यहाँ पे आया है. That one word, that conciseness has that much importance. Right? So if someone has to study materia, it has to be studied in such a way. I did that way, so I'm suggesting that way to you. Second thing, I was talking about philosophy. So I'll give you, if you're a curious reader, no, there are a set of books which talks about sound philosophy, right? अभी रेपर्टराइजेशन के बारे में we all know शशिकांत तिवारी, खन्ना जेवियर, we read those books for passing exams, but you want to understand the concepts, no? This thing, principles and practice, I told you, it's a complete package about it. Second thing, this is a small literature by Dr. J.N. Kanjilal. Kanjilal ka is a big name. He was practicing in around 80s and 90s, and he's a big name. He talks about the concepts कि repertorize कब करना है, कैसा करना है, क्यों करना है, क्या लेना है, क्या नहीं लेना. If you are sound with philosophy, you get an array of symptoms. Patient है ना 15 symptom बोलेगा दवाई दो. You get confused. But उसमें से out of those 15 things, what are the 2, 3 or 4 things you have to choose? Kanjilal helps, right? Another way, there are a lot of things you talk about theory. बहुत लोगों को लगता है बहुत theory है, practice का कोई बात नहीं करता. This small book. This is almost a 20 pages book, 27 pages book by Borland. Homeopathy in theory and practice. Where he talks, how much theory you want to read is in your hands, but उसमें से practically तुमको क्या choose करना है. I'm not teaching you books over here, but I'll suggest you certain good literature which is almost out of print, which will help you कि अच्छा ठीक है अपने को यहाँ पे limit करना. If you go on reading, you cannot retain anything and you can have a lot of knowledge, but that is of no use. But to put a full stop somewhere now, these are certain literatures that help you grow in practice. So homeopathy in theory and practice. This is one thing. Another thing that talks about philosophy, certain philosophy which a homeopath needs to build on, is this book, Plain Talks on Avoided Subjects. This is by H.N. Guernsey. Guernsey is also well known for his keynotes. His keynotes were ones which were before even Allen's keynotes came. Those are the most authentic ones before Lippe compiled a whole new red line symptoms wala book. What this book talks about, when I'm talking about sound base and philosophy and everything, what is this book about? Plain Talks and Avoided Subjects. So many a times we come across patients in our clinic, we are fired with certain questions, sometimes we don't have answers about, right? If a couple comes to you for counseling for infertility, they want to conceive, they're planning for pregnancy, so many a times we are in a soup, ये ना क्या आंसर करने का, कब तक वेट करने को बोलने का, क्यों वेट करने को बोलने का, on what tests and reports you should stand. There would be a frustrated mother who is having a child who is having ADHD kind of picture. इसको कैसा करो, शांत करो. वो टाइम पे what you have to talk to the parents in order to make them gain confidence that you will be able to settle the child. If there are cases, there are family members who is having a patient who is having some kind of psychiatric illness. They have put their hands down with all the, and they have come to you with hopes कि अभी इसको कैसा deal करें. So in that case, in that situation, how you have to talk and tackle with the stress of the relatives, tackle a patient of that sort, this book talks about. Adolescence में there are a lot of issues, hormonal issues. Simple acne के लिए लेके a lady can come in front of you and just keep on crying for hours, a 16-year-old girl. वो टाइम पे क्या टैकल करने का? It just talks about the daily routine, plain talks, but no one talks about those things. It also talks about something, if there is a widow and she's having her own emotional mental traumas, if a husband passes away and the way kind of things she has to face after that, उसके जो प्रॉब्लम्स है उसको समझना है तो उसको तुम कैसा टैकल करेगा. This talks about it. Okay? Lastly, there are three books more. After you're done with reading Organon from 83 to 104 and of that sort, this is something that will give you a very concise and a precise focus on taking case. This is Art of Case Taking and Art of Interrogation, both by Dr. Pierre Schmidt. These are very thin books. This book comes in a compiled format by BJN Publishers. Thanks to them. दोनों literature एक के अंदर आता है. He gives a lot of almost 50 years of his experience just by fine observations, how he comes down to certain rubrics and certain mental conditions, mental symptoms about which the patient has not even talked about. It gives you a keen eye. He throughout the case of half hour, 1 hour, 2 hour, where you have to focus and what you have to pick, simple observations he talks about. This is something that will also help you in the philosophy point of view when you are sitting in your clinic. Lastly, everyone talks about a lot about repertory and repertorization. This is something which talks about the this book is a gold standard about repertory and repertorization. Knowing the history, why things have evolved, how they have evolved, and what you should consider while repertorizing. This book is known as Evolution of Homeopathic Repertories and Repertorization by Dr. Jugal Kishore. This was recommended to us in our postgraduate days by Dr. Anup Nigvekar sir and Dr. Nikunjani sir as a gold standard books if you have to understand what repertory is. This person, Dr. Jugal Kishore, he has been a big stalwart. He has passed away. But this is the thing on which the whole story of repertory and repertorization stands. You know, the sound philosophy one needs is guided by this book. And lastly, for practitioners, there's a lot of things we hear about about the rare nosodes whoever prescribes कि diphtherinum देने का streptococcus देने का, but many of them don't know the base, right? There is a literature, specific literature, I don't know if you can see, it says nosodotherapy, isotherapy and opotherapy by Fortier Bernoville. I hope so if you are able to see this. This talks about everything about the isotherapy point of view, you know, कि diabetic patient है तो insulinum कब देने का और क्यों देने का, you know, diphtherinum कहाँ देना, the kind of isotherapy, the similarity देख के है ना बहुत सारे लोग देता है कि है ना सूरिक है तो एंटीमाइजेटिक सल्फर दे दो या फिर कुछ स्पेसिफिक हिस्ट्री है तो फिर मेडोरिनम पे जाओ. Why you have to go into this, and he gives a lot of concept clarity कि है ना कहाँ पे क्या नहीं देना है और कहाँ पे क्या देना है. So everything of this is for practitioners, what I've told you. So yeah,
That
up to you.
that was really a treat, and I have by looking all your this connection, I'm planning to buy a ticket straight away to Aurangabad, and I'm good at stealing as well. I can come with an empty bag and and get all these books from you. Okay. So here comes my next question. This question I usually ask to all the guests, those who come here. We all know there are so many schools of homeopathy prevailing. Not love is in the air. It's the schools, the ideology is in the air. And there are few practitioners, say Dr. Adil Chintanwala sir has said, you should be your own, practitioner. You should have your own school of practitioner. So we have
Yeah.
two. We have schools of others, pioneers, and we have our own school. What is your count in that? आम होम्योपैथ करे तो क्या करे?
ऐसा है कि when you are out of your undergrad, no, and you are confused whether to set up a practice or gain some more knowledge, do MD or set up a practice, go and learn under someone or what. There are a lot of hell different views and lot of confusion over there. I'll suggest whoever are in their undergrad, I'll suggest you one thing. Instead of just doing hospital duties for sake of money, do hospital duties. It's necessary to gain clinical knowledge. Spare some of your part of time to learn under the easiest accessible or senior most practitioners in your town, understand their philosophy, learn from them first thing before going to another school or big banners or anything else. Second thing, being a student, you should be open to learning. You should not fall prey to this question ki what school you follow. There are a lot of people who ask me ki what school you follow. I just say that I practice homeopathy. What school of thought I have to follow, that all depends upon the case that the patient gives me. You know, different schools is nothing but there are different ways, different styles of prescribing, which many stalwarts after years of their experience they have found out. And just for the benefit of the new practitioners, they have come up with their thoughts and literature. You can follow our school and this will help you in this way. Everyone is right on their own part based on whatever experiences they have. Right? Being a student, go to one practitioner who practices a certain school in a specific way, learn, sit with them 6 months, 8 months, 1 year, learn that school from them, learn the concepts on which a certain school works. Just to elaborate a few things, I have learned under Dr. Rajesh Kasliwal sir, who was a direct student of late Dr. Praful Vijayakar sir. I got to learn a lot about predictive homeopathy from them. For now, I'm sound with the concepts. Once I know I'm sound with the concepts, it's time for you to switch to have a certain new learning. You know? I've been sitting with a Dr. Praveen Bidkar sir, uh, who is a staunch follower of Dr. Shankaran sir. I learned that school since 2010. I have been following. It's a very vast school. It talks about a lot of clarity about kingdoms, sensations, and everything. Once you are into it, go through the literature, learn, read what they want to preach, go and sit at their place. They conduct a lot of seminars and everything. You get to understand the ideology, what they're talking about. I even got a chance to learn under this great man, Dr. Amar Sinha Nikam sir. He practices purely on Fatak, Borik, and Burger's concepts and treating simple colds to cancers just based on 30 potency, and he gets absolute results. Just need to go there, stand, and I also learned from Dr. Sanjeev Doye sir, who practices in Pune, who has a vast 40 years of practice. He talks about the rarest of rare medicines, how to prescribe them, how to give results. See, the patient is not going to ask you what school you are practicing. The patient wants results. So whatever you can gain, whatever you can learn, जहाँ से भी तुमको मिलता है, you should learn. And lastly, I'm a proud student from ML Dove Institute, which talks about the complete grounded simplistic philosophy what Dr. ML Dove has laid. And all the people who come and teach over there are the national and international level stalwarts. उनको उनके केबिन में खड़े रह के बैठ के काम करने का चांस मिलता है. Wherein they teach कि तुमको भोगर अप्रोच कहाँ लगाना है, बोनी वसन अप्रोच कहाँ लगाना है, कैंटियन कहाँ लगाना है, where you have to put a. So there are many schools. What I want to say is, being a student, you have to take your bite, how much you can take from each one of them. There would be many more schools in future also. You should not get stuck to just one thing. Get and gain whatever you want. And once you are done, once you are sitting in your own cabin with your patient, whatever the patient says, take it down on the paper. And after you're done with case taking, your philosophy starts working. Ki what you have to apply over here, not during the case. So yeah, that's my take. You have to develop your own practice, but you have to get the bits from all the people who have brought up, you know, brought up pedestals on their own experiences. You have to learn from all of them. Yeah.
My next question is, we have a question from the audience that
Yeah.
so whatever books you have told, how can they order it? And if we want some rare medicines or something, so do you have any lead where we can order books and medicines?
Definitely. First thing first, everything gets on their fingertips only these days. Amazon, Flipkart, these things are there where you can get any kind of books anytime, anywhere. Secondly, I'll be sharing a number of IBPP fellow to Dr. Anum. You can order from there. You can get a IBPP catalog from the person directly. Dr. Anum or any teacher who says कि जिसको पता रहेगा कि literature authentic है, काम आएगा या नहीं आएगा. Order, place your order, you get it delivered at your home. And secondly, if anyone wants any kind of books from Bijan, you can ask Dr. Anum directly. He has a direct contact over there. Secondly, for rare medicines, company is not an issue, but I usually prefer for rare medicines. St. George is a great company which gives you quality medicines, and rare medicines are provided by them. Secondly, for my regular practice, I use Wilmer Schwabe and SB. Yeah, I use a lot of mother tinctures also. St. George is also a great company. St. George, Bhandari, National Homeo Laboratory, Calcutta. Yeah, these are the companies that prepare quality mother tinctures as well.
Okay.
Yeah,
So, my next question is, I have seen a lot of practitioners, I've seen a lot of students, those who are starting their early practice, and उन्हें इतनी जल्दी पेशेंस नहीं मिलते हैं. I have seen so many students ऐसा बोलते हुए, मैम दो तीन पेशेंट्स आ जाते हैं, एक साल हो गया, 2 साल हो गया, है ना, ग्रो नहीं कर रहा है, इनिशियल ईयर्स है प्रैक्टिस के. सो आपका क्या काउंट है इसके ऊपर, क्या करना चाहिए, मतलब मार्केट कैसे बिल्डअप करना चाहिए टू गेट मोर पेशेंट्स, एंड that too practice for the betterment of the people, not for the sake of money.
yeah, yeah. First thing about this is these days, no, there is a lot of uh, focus in the social media about making money and the philosophy of making money, right? Every motivational speaker who talks about making money talks about one thing, that is compounding. If you know the concept of compounding, it is like you sow a beach, you sow a seed today, wait for its fruits, again replant those seeds, wait for its fruits, and you have to do this very patiently over a long period of time till the time the whole thing booms and you get a lot of it. Same thing goes with practice also. That's what I believe. As I said, officially I have been practicing since like 2.5 years now with a proper banner and everything. On the day one, I never had a patient. All the patients that I had in past in 7 or 8 years, they were waiting for me. They are saying, "Ki, aap sir, aapka clinic open kar rahe, we have to come and show." I said, "You can come over to my place anytime and you will get your medicines and everything." That's my part. The thing is, it's all about perseverance and patience you have to build. It's not about just watching 10 patients a day or one patient a day. You just have to look for a patient, treat him the way he is, give your best, and based on all sound philosophy, not like allopathy practicing specifics at a specifics, not of that sort. You have to keep a lot of patience, just like any other profession, any independent profession, like of a doctor, engineer, where you are not attached to an institution but you are establishing yourself. It takes minimum of 3.5 years for you to establish yourself. You have to find a spot for yourself where you have to sit and practice, where you're accessible to people, make yourself available to people as easy as possible, sit in 2 different places, 3 different places, but be consistent over those places in those given times for those many years. And whatever quality work you are able to do, no, out of 4 or 5 patients, when you see and you give them good results, out of 5 patients, there would be just one patient will be bringing you one more patient. You know, just looking at one patient and you will be expecting he'll get you tons of patients. That is not going to happen. I'll just share you one small experience of mine. In my initial days of practice, even before I started my own clinic, I had an infertility case who had failed with 3 or 4 IUIs. They came to me. I just So what happens is when you're going on treating patient after patient, giving results, there would be someone who would be triggered, and they'll send the whole family, the whole community of them to you. To reach that person, no, you have to go through a lot of other people giving results. See? So hota kya hai? For initial 3.5 years, you have to sit patient, you have to be consistent, sit in your place. Whatever one patient, single patient you get in a week, that is not a problem. They're coming for homeopathy, that's a big thing for you. When you will be consistently sitting over that place for 3.5 years, whatever you have to gain, whatever number of patients you have to gain, you'll understand कि आपका future कैसा रहने वाला है based on that. Not in 6 months, not in 1 year, not in 2 years, 3.5 years. You have to sit. In any profession, it may be. हमारा profession में you have to. If someone has some financial difficulty, they can do a part-time job in any college, or they can do a hospital duty. But you should not lose your practice. Your practice can be 4 patients a day. It can be one patient a day. It can be 40 patients a day. But to grow till 40 patients a day, you have to devote yourself that way. You should have to be available. That is important. You have to sit at one place for almost 3.5 years. Be consistent. It will grow.
I mean, this I really agree with you. बिकॉज प्रैक्टिस शुरू करते ही पेशेंट ऐसे नहीं आने लगते कि आपको लगेगा आपने ऐसे क्लिनिक खोला और किसी सीरीज की तरह आपके पास पेशेंट्स बिल्कुल ऐसे आने लगे. इट नीड्स टाइम एंड व्हाटएवर यू सी ऑन सोशल मीडिया के लाइन लगी हुई है और आपका कोई आप जिसे फॉलो करते हैं वो बस उसने पेशेंट्स देखने शुरू किए, देन गो बिहाइंड एंड सी ही और शी माइट हैव स्ट्रगल्ड. उन्होंने ऐसा भी टाइम देखा
Exactly.
है जब 4-4 दिन पेशेंट्स नहीं आते. और हमारे साथ भी ऐसा होता है. इस चीज को बहुत
होता है.
नॉर्मलाइज रखना
Exactly.
चाहिए.
Yeah.
हमारे साथ भी होता है. कभी कभी हमें चाय पीने को भी टाइम नहीं होता और कभी कभी हम भी खाली मतलब सोशल मीडिया पे इधर उधर रील बना देते हैं. सो दैट हैपेंस, वेरी नॉर्मल. एंड
तो वो
जितना
3 साल
जल्दी इस
में
चीज
आप
को
क्या,
एक्सेप्ट.
वो 3 साल में आप क्या कर सकते हैं when you are having actually a lot of time and you are actually getting problems from patients? No, what you can actually do is sit yourself, devote hours of yourself and go on reading and absorbing things from authentic literature. That is one thing I'll suggest. बोर होने का काम नहीं, आपके पास बहुत काम है. सिर्फ पेशेंट देखना काम नहीं है. You have to gain a lot. Yeah.
एक क्वेश्चन ऑडियंस से और लेती हूँ मैं.
Yeah.
डॉक्टर अरीना खालिद पूछती हैं कि इन chronic cases we can give 1 m potency single dose दिया, how far we have to wait to see the difference?
Okay. नाम क्या बोला आपने डॉक्टर का?
अरीना खालिद, डॉक्टर खालिद.
डॉक्टर खालिद. डॉक्टर खालिद. See, Dr. Khalid ma'am, there is no such hard and fast rule. Chronic case रहेगा तो you stick with 1 m or 200 or 30. It's all the susceptibility of the case that decides your potency. Right? First thing. Second thing, if I'm having 3 different chronic cases, right? Some say one of APD, one of migraine, and say one of bronchitis. Simple cases. It's quite possible in case of bronchitis, I'll require a specific constitutional medicine, but in low potency. If in case of migraine, I'll require 1 m potency of certain medicine in frequent repetition as well. In case of EPD, I might require a 30 potency of single medicine, single dose, and I can wait and watch for 1 week or 2. So the thing with homeopathy is everything is variable, everything is based on the individuality and also how sound the physician is with the philosophy. So if you know your patient is responding with 1 m of medicine, what I usually do in practice is when I have to go with a higher potency 1 m or something of that sort, even if I'm very much sure, I'll give a dose, wait for 15 days or 2 weeks. When I get a follow up, I see a certain kind of registration, I'll directly wait for is the same 1 m dose for 2 doses, 1 dose a week, 1 dose a week, weekly dose. When I'm quite more sure that this is helping, I'll not need any intercurrent. Maybe I'll wait for a while, put the patient on placebo, or I'll increase the repetition to Monday, Thursday, 2 doses a week. So gradually, when you go on increasing the repetition, or that all comes from the judgment from the patient's follow-up. कि क्या लेवल पे तुमको इम्प्रूवमेंट मिल रहा है, इमोशनल मेंटल लेवल पे है, जनरल्स बेटर है नहीं, द चीफ कंप्लेंट्स व्हाट एवर द पेशेंट हैज कम टू एड्रेस फॉर यू. So the question of potency remains that way because homeopathy is completely based on individualization. We cannot have specific protocols for everything and anything. कि कितने बार repeat करना, there is no hard and fast rule. So 2 patients of migraine, you can have Pulsatilla 1 m ka single dose to one patient and the patient is better for 3 months together. And in a certain way, different patient might be requiring, for example, a dose of Nitromor 10 m almost every third day or every fifth day. That is also possible. It depends upon the uh, how the nature of chronic disease is in that person. Yeah, over to you, ma'am.
Okay. So my next question is, I have done hospital duty for
Mm-hmm.
3 years. I've been practicing in a district hospital with no stipend and no money, nothing, no monetary benefits. What do you think? You think hospital duties are important, or you think it's just a trap? They pay you 30,000-40,000 rupees and they take your, dreams. What is your count on that?
30,000-40,000 is a big thing for someone who is doing it in Pune or Mumbai. It's very less over here. Uh, Before answering that, I'll ask a just simple question. What are we? After doing 5.5 years of good education equivalent to MBBS, just your pharmacology thing is not there. What are we? You're doctors, right? We are first doctors, then we are homeopaths. Right? Animal was the same thing. If you don't know to differentiate between osteoarthritis and rheumatoid arthritis and what investigations you have to do to come to a differential diagnosis and decide कि ये label है भाई ये patient का. Unless and until you are not clinically sound, you don't know what the patient is suffering from, you cannot do anything about it. And if यू आर कट्टर होम्योपैथ, ये ना मेरे को एलोपैथी सीखना ही नहीं, हॉस्पिटल ही नहीं जाना, कुछ नहीं करना, मैं पहले दिन से यहाँ पे बैठूंगा और अपने को एसिडिटी इंड्यूस्ड हेडेक्स और सिंपल माइग्रेन्स या क्लस्टर हेडेक के बीच में अगर डिफरेंस नहीं समझ में आता है तो यू आर बूम्ड. So it answers your question then and there only. We should be able to do as many internships as we can. We should be able to devote ourselves as much as we can to learn from whatever modern day practitioners do. क्योंकि तुम्हारे को पेशेंट का डायग्नोसिस समझ में आना चाहिए. दैट्स द बेसिक थिंग ऑफ बीइंग अ डॉक्टर. या तो पेशेंट भी बोलता है कि 5 symptoms I put in Google, I think I have this kind of illness, treat me with this. Many a times you have to correct the patient that is my job. You don't come with a diagnosis, you just give me complaints and you understand whatever patient is talking about to uska diagnosis hai nahi. You have to make a diagnosis for the patient. Hospital duties are really very important. Hospital duties teach you to deal with emergencies, teach you build your own personality in a way, how to manage a panicky situation. They put you in a stressful condition where you have to manage 10 patients with their regular monitoring, someone who is having an MI, someone who is continuously vomiting over there, someone who is there with a kidney stone ka colic, and also someone who is having a simple headache but their parents are making tantrums over there. So as a doctor, when you are seeing a patient who is running into your cabin anxious and saying कि something is happening to you, and you are also going anxious कि अच्छा तुमको ये हो रहा है, so it's not helping. Being a doctor, you have to be calm with what is happening with the patient, making them understand, keeping them calm. Hospital duty teaches you that. Throughout your 5.5 years, 3 years of MD, wherever you get, I myself did around 7 to 8 years of hospital duty and practice. I did and I learned allopathy from there also, but I don't practice allopathy. The reason is क्योंकि 10 साल आपने किसी चीज में स्पेशलाइजेशन में डाला है तो you should know what you are capable of doing. So yeah, this is a very brutal truth that without students of BHMS, BAMS, no allopathy hospital can stand on their own. No MBBS or DNB consultants or MD medicine can stand 24 hours in their general wards and take around. They cannot do that. It's their need also. It's a give and take kind of thing where BHMS students get an opportunity to go over there and brush themselves clinically. They get their work done from you. You get to learn from their experiences as well as modern day clinicians. And you have to brush yourself clinically, come out and practice homeopathy. That's what I have to say.
So we have a question from audience. I mean, that's very honest answer, and this is solved. I'll make a reel out of it for those who will be asking me, "Ma'am,
Sure.
Okay, there's a question by Dr. Himani. She's asking what to do if we don't get PQRS symptoms.
Okay, Dr. Himani, that's actually very vague question. For that, I'll give you certain hints about certain literatures where you can get help of it. First things first, if you are getting a patient, you are done with everything, you are getting a complete detailed history and everything, proper case taking, whatever is required, and still not getting any PQRS. Just for example, I'll talk about uh, a patient with a kidney stone. Just for example, okay? You are knowing there is a sonography, you are knowing where the stone is, you know there is a vague symptom कि कभी भी पेन आता है कभी भी जाता है which is not characteristic and your patient is saying कि अभी इसको ठीक करो. Many times it happens in our clinic also. Patient आता है बोलते हैं कि मेरे को इधर उधर ठीक करो. क्या ठीक करने का? You don't get any characteristics of it. So at certain kinds of times like this, you have to play with certain group of medicines, certain potencies. Just for example, biochemic system of medicine comes in over here and mother tinctures play a role over here from my point of view. When you are not having too many PQRS symptoms, not very characteristic symptoms, but at least you know what the pathology is. For example, kidney stone रहेगा, migraine रहेगा, EPD रहेगा, carpal tunnel syndrome रहेगा, osteoarthritis रहेगा, any sort. तो तुम्हारे पास पेशेंट कंप्लेंट लेके आया है एंड देयर इज नो कैरेक्टरिस्टिक्स, दैट मींस यू हैव टू ट्रीट द चीफ कंप्लेंट ओनली. यू डोंट हैव एनी अदर स्फीयर टू वॉक अवे फ्रॉम. अगर पेशेंट आके बोलते कि ओनली माय राइट नी इज पेनिंग, हेल्प मी विद इट, देयर इज नो मोडालिटीज, देयर इज नो कॉज, nothing else is there. There are no concomitants. So what you have to look for when there is nothing PQRS, the pathology itself becomes a PQRS that you have to treat. That's what I understand. But when you are lacking characteristics, but you only know a location and a simple pathology, at that time, what your philosophy has to be, there has to be a simple prescription which covers the sphere of action over there. Third thing, frequent repetition of certain remedies in low potencies which will not aggravate anything else. That's why mother tincture and biochemics come into play. Even if you are fine, like simple things like these, simple osteoarthritis, which has common symptoms of, uh, Rustox has common symptoms of these. Start giving with a Rustox kind of 30 potency once in a day for 7 days and see the improvement. Maybe some characteristics can come in second or third follow. So when you are lacking with PQRS, you just know the location and a pathology. Go with that specific medicines which will help that patient in that specific spheres. I'll show you if you there are a lot of literature about biochemic system of medicine, but there is something that is very authentic and specific, which is this one. The biochemic, the biochemical treatment of disease, which is by Schussler himself. And secondly, another authentic author is E.P. Anschutz, A Guide to 12 Tissue of Biochemistry. Simple. 12 remedies you have to understand. And when you know that there is no characteristics, when you just know there is a location and a pathology, you have to go through it. Another thing I'll tell you, can I take a moment now? I'm talking about certain literatures for this question specifically. There is this literature by Yaduvir, Miracles of Mother Tinctures. It's a very short book. It has a therapeutic index also and a materia medica section as well. And if you know there is a patient who is coming specifically for adenoids, तो तुम्हारे को पता है कि उसके अंदर उसने बोले कुकुमा लौंगा मदर टिंचर देने का. It's as simple as that. Secondly, there is another authentic book, Therapeutics by Waves, by Dr. E.P. Anschutz, the same author. So what this author does is, just for example, there are different conditions and he has written his experience. For example, for digestion, he gives you a specific remedy and he'll give you a hint to avoid indigestion or digestion related issues. What are the lifestyle changes you have to do with the patient? Being doctors, we come and stick over to the medicine name only and we don't go think further only. तुमको dietary measures भी देना पड़ता है. You'll have to give secondary ways of things also to modify. So this is the question. When we are not having PQRS, you have to rely on certain literatures will specifically target a certain condition and help the patient in low potency frequent repetition, obviously. Yeah. I'm actually having a lot of literature over here. सोच के रखा था तो मेरा ध्यान आ जा रहा है.
Yeah, don't worry. Those who are getting worried for all the books name, whatever books Dr. Vansh has shown in this, he will be definitely sending the pictures to me and I'll make a beautiful collage and will present you as a gift, home taking gift for all of you. So you can have the screenshot or you can just save the post. Okay, is that okay?
Yeah.
Okay, so we have the second question for you. This is, from our peers, and the pressure comes up when our peers ask the question.
Yeah.
Okay, so the question is, Dr. Sheikh is asking, if we repeat higher doses in 10 potency so frequently, does it change the mentals or the generals of the patient?
Mentals or generals of the patient.
The patient. Yeah. Or does it affect the nature of disease of the person?
Okay. First things first, when you are prescribing too high potency, either you are very much grounded and sound about what you are prescribing, what potency and what repetition, you are having a sound knowledge enough, or secondly, you are very ignorant as a physician. Many a times I have seen and heard from younger colleagues in their initial practice, they just want to give certain results to certain patients. बहुत जल्दी से काम करना चाहिए under the pressure of the relatives or family members, and they end up giving belladonna 1 m, belladonna 10 m, something of that sort कि जल्दी से ठीक हो जाना चाहिए, and the patient gets aggravated और फिर boom होता है. That is that kind of thing comes from ignorance first. Secondly, when you know the nature of disease is of an autoimmune character, you have studied the IgE reports of the patient, which are very high. There is a lot of action going against the patient in his body himself. Over there, out of the experiences of the senior practitioners. For example, Dr. Uh, Kishore Mehta, sir, if you have heard him, he does a lot of work on uh, MS, sclerosis. So over here, out of a person who is of such a vast experience and cadre, he talks about giving medicines in 10 and 50 potencies in frequent repetitions. And when you ask him reasons and everything, he, out of his experience, he says, of 40 years of experience, he says, 30, 200, 1M, nothing helps. And because of his experience, ये नहीं काम करता, and he has come to a stage that he has to give the same medicine in 10 or 50 in frequent repetitions, after which the patient finds some relief. So Dr. Sheikh's question is that does it alter the mental state of the patient? Right? If your remedy of the nature of the disease, right? So when we are talking about homeopathy treating such autoimmune conditions, all the sorts of things where allopathy only has steroids as answers, we should know our own limitations as doctors. That is the thing I believe. If you know there is a certain condition which is irreversible that cannot be corrected, you should make yourself think in a way that you have to palliate a patient and not run behind curing him when you know it's not the thing. Many a times when the right medicine is prescribed in a specific potency for that state of complaints for which patient has come in, many a times the nature of disease also changes. For example, a patient of ankylosing spondylosis, 5 patients of ankylosing spondylosis can have different kind of set of symptoms. And if you try to analyze all of them, you will understand कि ये ankylosing spondylosis तो है pathology से, but the group of symptoms is giving, they are so soric, they are so psychotic, these are syphilitic kind of states. If you apply your knowledge of miasms over there now, usually the psychotic and syphilitic group of patients, you will not be able to make a lot of difference to their set of pathology or the mental state of the patient as well. If you are able to differentiate and understand that there is a lot of soric picture in the background, you can make a lot of difference and avoid the patient from getting into a much uh, deteriorated state later on. So yeah, it's your understanding of miasms of a specific pathology which decides your prescription is going to change the whole disease picture for them. Yeah. Yeah. In the background, you can make.
Can you hear me?
Yeah. I can absolutely hear you.
Okay. I think I can't hear you.
Is it fine now?
Okay, I'm getting up. That's okay. You can hear me, no?
Yeah. I can hear you.
Okay. So my next question is the last question of the session. I've taken a lot of valuable time of yours.
Yeah.
If I say that this year, 2022, is the year of opportunities and upliftments. So what is your count on that? What new we can do this year for the students, for the betterment, or for filing their skills and promoting their business for the practitioners? How this 2022 can bring opportunities and upliftment?
Definitely, I answer that. It's been 2.5 years. Every one of us is going through this pandemic situation. Right? If new practitioners sit and just think whenever the pandemic will get over, and then I'll sit and start my practice, maybe after 6 months, a year or so, you're going wrong. The pandemic is a situation where everyone is restricted to their boundaries, but as doctors, we have a complete. This pandemic situation. मेरे आवाज एक बार है, sorry. New practitioners sit and just think whenever the pandemic will. Hello, can you hear me? And then I'm getting a start my practice. Maybe after 6 months, a year or so, you're going wrong. The pandemic is a situation where can you hear me? It's a echo आ रहा है मुझे मेरे boundaries, but as doctors, we have. It's fine now. Yeah, now it's not equal. What I was saying, as doctors, you have this liberty of going out and working with patients, working with COVID patients, with whatever experience you have. It's not a time where you will sit at home and just do reading or wait for the pandemic to settle down and then you will go and sit and practice. No, doctor's life is not about comfort, it's about taking challenges. That's what I believe. First thing. Secondly, there is something I have grown out of these whole 2 years. This pandemic situation has helped me a lot grow my practice. I'll again give you examples. I have almost more than 150 or 200 cases related to COVID pneumonia, group of literatures that has really helped me, which is written long back. The first thing is this: homeopathic treatment of influenzas by Borland. Yeah, Borland. Simple book, simple prescriptions. Influenza, and you have to understand things clinically. Correlate them, prescribe them. जब तक prescribe नहीं करोगे तब तक नहीं होएगा. And these two literatures have helped me a lot in treating pneumonia-like cases in COVID times. Right? This is by Pulford ka Leaders in Pneumonia and Borland Pneumonia, which is a very famous literature. When we say we are having a year of opportunities now, we are having a lot of uh, Omicron cases on the rise these days, and it is anticipated that in a few days or weeks or months it can happen that you can have lockdown kind of situation again. So as doctors, I feel we should go out, look for opportunities, go for hospital duties if not having your own clinic. Dedicate yourself to serve patients in this pandemic situation. Earn certain fortune out of it, save it for later that you can use your money for your setup or medicines or anything of that sort. And when you say this is a time of opportunities, this is a certain kind of variant which is coming up now and then. We are getting a lot of push, see how it is different from the Delta variant or the Alpha variant of the COVID we had earlier. So the whole medical system is a kind of evolving thing. What was new today, which would be outdated tomorrow. There is some new information coming into now. And as a practitioner, if you're not updated with the new things that are coming up, you're just a namesake doctor. That's what I feel. So when I say it's a year of opportunities for us, we should upgrade ourselves with whatever cases we get. Even if you're not having sufficient knowledge, have confidence enough to take a detailed case, work over it. If you are not confident, discuss with your seniors, your teachers, make a prescription. जब तक खुद के हाथ से नहीं दोगे, आपको confidence नहीं आएगा. Right? And secondly, when you say my own clinic, I started with my dear colleague of mine, Dr. Hina. उनके साथ में I started my clinic in collaboration. After lockdown thing happened, I went for COVID duties. After that, I started my clinic with a dentist in a sharing thing. Now I'm sitting at two different places with a pathology lab and my private practice as my own. So what I want to say is you don't have to get stuck in one place just because the pandemic thing is going on. ये कोविड पैंडेमिक चलेगा उसके अंदर समथिंग न्यू विल कम तो यू विल नॉट अर्न योर ब्रेड एंड बटर ऑन you can use all of these times to upgrade yourself and make yourself available to as many patients as you can and give your services. That's what I want to say. There is where your opportunities coming. Yeah.
Okay.
And yeah, you're audible. Before we end, just give me a 5 minutes window at the end. I have to give certain specific literatures. So आप बोलो, at the end I'll do that.
Yeah. So, thank you so much. I would like to say a lot of thanks because it was me who was behind you. Because I was knowing about your literature, your library, your collection, but I want, and you've always been supporting budding homeopaths, not by just sending books, but telling them that study, study, study. Only this can enhance your skill. And I'm so glad you are here. And I must tell you this: this session was among such sessions which I had like with Dr. Adil Chimtanwala sir or Dr. LM Khan sir with the highest viewers, live viewers at a time. I must say. Yes, I'm not comparing you. I'm just putting you into that
Those are
section.
real stalwarts and they are the great people. I'm nothing in front of them. It's just what little I'm having, I'm sharing it to you.
I'm just telling you, and a guest should know, that this session was among those sessions where people were, so alert. Even we didn't hit 100. The live viewers were more than 100 every time, not even a single minute.
Yeah.
Okay.
Yeah. Thank you.
Yeah. Over to you. Over to
Yeah. Before I go, I'll suggest a few things. To see, I talk a lot about reading, because that is the only thing that is going to keep you upgraded. And we have a lot of literature by different authors. If you go through them, you will be able to understand कि ये situation में दे सकते हैं. If you haven't read anything, you would be just stuck on 3 or 4 specific prescriptions. Just for example, I'm going to show you a few literature which helps me a lot in my cases, right? Uh, the very first thing, a very authentic literature, I'll say, this book. This is a very small book, 300 pages book, which is known as the Accoucher's Emergency Manual for Pregnancy by W.A. Yingling. Many people don't know about this book. This author talks about how you deal with a patient who is in pregnancy, who is not having pains, who is having a dead baby delivered, who is having eclampsia after the delivery. A lot of those sort of 108 remedies with a specific materia medica of for those headings, एंड दिस हैपेंड कि ये छोटा बुक है, आपको लगेगा कि अपन प्रेगनेंसी वाले में कहाँ में जाके हम कहाँ पे जाके मेडिसिन प्रिस्क्राइब करेंगे. वंस इन अ ब्लू मून आपके लाइफ टाइम में एक अपॉर्चुनिटी ऐसा आएगा कि है ना, you'll get some patient who is not getting labor pains, and out of this simple knowledge you are able to give that patient certain medicine. It helps them with the labor and you are able to avoid a C-section for that patient. Your purpose is solved of having this knowledge. There are certain literatures which are very specifically focused on certain conditions, and you should know those conditions and where to look, what literature to look. Every time you cannot open a book and go, ये भी match हो रहा है, ये भी match हो रहा है. Nothing of that sort will help. You'll have to focus on specific literatures for developing a clinical practice. Every patient is not going to give you medicines, right? That is one thing. In recently in discussion with some senior doctors, this happened. In one of the senior practitioners was having a patient who was not progressing with labor. Dr. Anam also knows about that case, and he called his senior colleague what to do. And out of the knowledge of this specific literature, that doctor told give certain medicine in certain dose and repetition, and the C-section was avoided. Try to understand the simple philosophy of 2 or 3 doses with the sound philosophy. If you are prescribed in the right time, आपके पास ऐसा फोन आता है एंड यू आर अंडर कॉन्फिडेंट, यू डोंट नो एनीथिंग ऑफ दिस सॉर्ट, नहीं यार हम कुछ नहीं कर सकते यार, अपॉर्चुनिटी इज गॉन. दैट्स व्हाट आई एम सेइंग. दिस इज अ ईयर ऑफ अपॉर्चुनिटीज. आपको जो मिलता है वो लेना है. There are certain more literatures I'll talk which talk specifically about certain conditions, right? Everyone knows about burnet. This is a book about curability of tumors. It talks about tumors of cancerous kind, benign kind, even styes, simple warts. He talks about these things, and he has specific array of cases where this person has given a lot of cures to the patients. Unless and until you're not going to read it, you're not going to get it. स्पेसिफिकली इन द सेम वे, ये बहुत पुराना बुक है, सब चिपकाया हुआ है, इट्स आउट ऑफ प्रिंट. Gout and its cure, same by Burnett. You get a lot of patients, will get a lot of patients where you'll have a patient with a high uric acid and there are no specific symptoms. The patient is saying कि ये फेबो टेस्ट चलो, ये चलो, कैसा बंद करने का. There is a specific literature about rheumatism, about gout, which will going to help you clinically in your practice. That time, if you sit and say, okay, how do you feel in your stressful state? Patient will just walk away. That is not going to help you. It's not that every time the mental symptoms are going to come to your rescue. Those are not those cases. 10 में से 3 केस 4 केस आपको मिलेगा, you'll get a whole picture. Rest of the cases will say कि मेरा भी 300 250 sugar आया, how you have to get it down. You have to know the specific medicines. There are specific literatures. Another book of very helpful in practice. This is Borland Children Types, where he categorizes the certain group of remedies in 4 or 5 different classes, and based on the group characteristics you come down to specific 1 or 2 or 3 remedies that you have to differentiate. It talks about simple toothache to simple coryza like complaints to diarrhea in children, but it talks about the dispositions of the children in those 5, 6, 7 or 8 groups. You come down to those groups, decide which group the patient belongs to. There are 4 different remedies, differentiate them clinically, prescribe, the thing is done. This thing you will not going to get through Boric or reading Allen or reading Kent. This talks very specifically. आपके पास में baby है, you should know this thing if you know the dispositional qualities. There are a lot of patients and people who say कि होम्योपैथी स्लो काम करता है, chronic में काम करता है, acute में you're not giving results. Dr. Anum also might be getting all those kinds of questions from so many people. There's a specific literature by Dr. M.L. Tyler. The name of the book is 36 Outstanding Homeopathic Remedies for Acute Conditions, Injuries, etc. with special indications for their uses. This specific literature talks about the specific conditions. For example, diarrhea, anything in acute. Huh? Anything in acute. She has given 36 different acute conditions, right from cholera, diarrhea, migraine, kidney stone troubles, right? उसके बाद में scarlet fever. We are having a specific diagnosis, a specific group of 4 or 5 remedies that are going to help you in acutes. Simple acute prescribing. So what I'm trying to say is this 40 pages small book, when you are able to understand the differences and gulp it down and you get an acute condition, so within few minutes, you should be able to come to the remedy prescribed, give a result. That is the purpose of this. Everyone has a software, everyone has a repertory sheet, but you are going to take, 400 remedy ka rubric, diarrhea, फिर anticipation, you'll coming down to argentum nitricum. It's not helping. क्या करने का? So there are certain specific literatures which talks about dealing specific conditions. Very important one, I'll put it up to you. Infertility and its cure by homeopathy. Right, this is by Dr. Paras Mangala. This is again a different literature. एक और ऐसा book आता है डॉक्टर निकुंज त्रिवेदी का. It's about sperm disorders. So this is a booming, alarming condition in this era. Infertility is a very hot burning topic, and there are very few people who have authentic literature about it. So this author deals with actually if the problem is with the female patient, if it is a problem is with ऑब्स्ट्रक्टेड फैलोपियन ट्यूब, तो किधर थायसेमिनम देने का, किधर एसिटिक एसिड देके वो डिसॉल्व करने का. ये स्पेसिफिक क्लिनिकल इंडिकेशंस वेयर इन कॉन्स्टिट्यूशनल मेडिसिन का यहाँ पे बात नहीं किया गया है, बट when you know there is a specific thing over there, you are done with constitutional medicine. If it is not helping, तो where you should knock your head. That is the thing. Same, like I showed you children types, there is another book by D.M. Borland. तो इसके अंदर होम्योपैथी फॉर मदर एंड infant. When a mother goes through pregnancy, delivers a baby, and up to a year or so, whatever kind of conditions a baby goes through, simple feeding problems, galactasia, mother is having severe lumbar pain after the delivery and everything, nothing is helping. At that time, simple specific 30 pages book. You know, this is a literature you'll not get anywhere. You might have heard about this literature at many different places. The name of the book is Coma and his Homeopathic Cure, Homeopathic Treatment by Maganlal B. Desai. This person has passed away. Probably, if you become a cadre of that person, ever you get to treat a coma patient ever in your life and get him cured, this is the literature that will help you. ये पढ़ के रखने का या फिर ये चीजें हमारे पास में रहनी चाहिए, दैट इज इंपॉर्टेंट. आपके पास पेशेंट रहे ना रहे, you should know if you are thrown with a certain kind of condition on you should be able to how to tackle it, how to treat it, you know. Lastly, there is a specific literature on hematology, homeopathic hematology by Dr. Rajiv Saxena. Simple pancytopenia, leukemias of different kinds, thalassemia, all these conditions, palliative care, curative treatment, intercurrents, anything related to blood disorders. This person has put up a whole of experience into this. I don't know how many of you know, there is a doctor who works on hemophilia from Nashik, Dr. Tapas Kunde, and he has a whole lot of published literature, more than thousands.
Somebody asked about skin disorders book. There is book of skin diseases by Dr. Farooq Master. Very good afternoon. You don't worry, we'll post all the books with their pics and name of the authors after this session. Am I audible? I'll not forget, don't worry. I just have OPD after this, but by evening we'll post the all the books and with their authors and from where you can get. Sure. No problem, no problem. We'll send that. I'll try to connect Dr. Vansh again. Software for reporterization.
Am I there now?
Yes.
Okay, sir. I don't know what is the last thing the audience saw.
You were telling about the book of hematology. You just finished.
Achha.
Yeah.
Can I take 5 more minutes? Just 5 minutes. There are two specific literatures I want to talk about. One thing is this book, Snapshot Prescribing by P. Rajgopala Rao. And secondly, there is a book, very effective but neglected remedies in homeopathy. This literature by the same author talks about certain specific rare remedies in certain specific conditions with short results. So these are the things for practitioners where they say they are enough of constitutional prescription is not helping, intercurrent is not helping, what to do? You have to go with the specific medicines. Now, there are two specific books for young curious practitioners who want to know how to approach in a case, right? Very few people know this book, Clinical Experiences by S.R. Pathak. Pathak ka Materia Medica and Repertory everyone knows, but how you have to use this book, I'll tell you. There are more than 100 cases by Dr. S.R. Pathak into this book, ranging from 4 lines to half page to 1 page. Or iske backside mein you have a gem of cases by Dr. P. Shankaran, which he used to take to Dr. S.R. Pathak to get them treated. तो तुमको क्या करना है एज अ प्रैक्टिशनर, एज अ यंग क्यूरियस प्रैक्टिशनर, व्हेन यू हैव टू यूज अ लिटरेचर नो, तुमको क्या करने का है, ये बुक लेने का है, इसमें केसेस दिए हुए हैं, मेडिसिन नहीं पढ़ना है, क्या मेडिसिन दिया है, 4 लाइन का केस रहेगा, वो 4 लाइन का केस पढ़ने का, पाठक का मटेरियल मेडिकल रेपर्टरी साथ में रखने का, look for a specific rubric you have to understand from this, look into that, come to a remedy, analyze the case and then look for a remedy if it has helped your life. इससे क्या होता है, तुम्हारा you will make your head run, analyze things and come to a remedy how this person has came to the remedies, right? Secondly, the same way, there is a book called The Amazing Power of Homeopathy with 200 cases. In this book by Gunwante, what he has done, he has given 200 different cases from different authors. आधा पेज से लेके 4 लाइन तक का केसेस है. What you have to go through a case, remedy क्या दिया और क्या source he has given at the end, कौन से practitioner से लिया. Just go through a case, small case, analyze it, what you understand, go through repertory, go through materia medica, and then see the answer at the backside. For example, I will give you a specific case into this where there was a small infant, 4 days infant who didn't pass urine, the vaginal opening was not there. That was the only case. He prescribed certain medicine, the vaginal opening opened on its own, the baby passed a lot of pus like urine and everything was normal. You just try to understand a 2 or 3 year old baby who is not having a vaginal opening and there is no option other than operating. What you will do with homeopathy? Graphitis sternum was something that was prescribed and it helped. So you have to go through cases and you have to question the things what they have done, and just by reading those cases you analyze your head what you are doing. Lastly, 3 books I will be showing you. There is a book called Drugs of Hindustan. There are a lot of Indian remedies that have been written in, and a lot of Kolkata people follow this book as well. It's a specific separate materia medica kind of thing with all the Indian drugs. which have a lot to do in practice with mother tinctures of these medicines. Second book is Up to Date with Nozodes by B.K. Sarkar. Up to Date with Nozodes by B.K. Sarkar. The thing is, this is also old literature, but it has a very specific literature with Uforinum, Lac vaccinum, Malaria officinalis. And lastly, many of us are very much tempted with the Kent repertory. But very few know whatever Kent repertory we use. It's a third edition of the American edition of Kent repertory, which has a lot of shortcomings into it. So this repertory, Kent's Final General Repertory, is the eighth edition of the original Kent's repertory by Pierre Smith and Diwan Harishchan, and it is the most authentic Kent repertory if you ever have to follow in your practice. So this is the thing. If you have to follow Kent repertory, understand Kent repertory, original Kent repertory has a lot of shortcomings. All the shortcomings are taken up by this book, and it's a most updated version of Kent's repertory. If anyone has to follow it, and for all the practitioners who want to do a clinical practice, specific practice, pathological prescriptions, this is the answer. Best of Burnett by H.L. Chitkara. Over here, whatever Burnett's literature, around 30 or 40 literature of Burnett are compiled into this one single book. Instead of having 40 different books, you can refer to one single thing. So yeah, over to you. I'm done.
Thank you so much. And I would request you to send me, I know it will take 15-20 minutes of you more, but please send the pictures of all this book and I'll segregate it, I'll compile it, and I'll post it. And don't worry, I'll give you the proper acknowledgement because you
No, no,
came here,
don't worry.
and trust me, it was very, very, very mindful, eye-opening session. I had, matlab, I took a lot of screenshots, pata hai, lot of screenshots. I should miss the
I,
books which I want.
I would like to take just one last minute. One last minute. To all the practitioners and all the students out there who have this question of authenticity of literature and basics of homeopathy and concepts of homeopathy, I just want to quote you one thing. There is a whole ICR school of homeopathy which has a lot of authentic literature, authentic research papers which are unquestionable. I'll just show you three books of those sort which are known as symposium volumes, which has the research papers of all the stalwarts from where the questioning and thinking thing began कि segregation कहाँ करना है, analysis of symptoms कहाँ से लाना है. So these are the three books which are very authentic for a practitioner and a student as well, which has the original literatures, right? This is the symposium volume 1. The second thing is the symposium volume 2, and the third thing is the symposium volume 3. It talks about repertorization, case taking, analysis, how to study, how to read, talks a lot about symptomatology, philosophy, everything. Good thing is this thing is available with MLD Trust, and these days they are giving some kind of 10% of discount on their purchases. So if you really want to have a authentic sound based literature, you can definitely count on this thing and principles and practice of homeopathy. Yeah, Dr. Anum. This was a very, very, very mindful of you to give me this platform to share whatever little I know about whatever homeopathy.
Okay. Thank you so much. And the whole audience, students, we are so overwhelmed. You came, and trust me, nobody shares their books, their knowledge, what to study, what not to study. Even though we go and, stand with some people, they were like, बस सुनते जाओ, तुम सोचो, तुम पढ़ के आओ. But it was very insightful, very simple, in language which we want to hear. And you shared it so transparently. I mean, thank you so much. I have no words actually. I am today, I think in these 36 episodes, I never felt I've been so speechless. I'm out of words. How to thank you? I had
That's so kind of you. Thank you.
I marked the date today because I don't have words, to thank you enough. And I'm sure this year we all will study and we'll keep you posted what we are studying.
Definitely.
And people are saying, Dr. Anant is saying, please come again to share your experience. My God, you are worth hearing, sir. And everybody
My
is
God.
so over. Not just
Whenever
me, every.
and wherever it happens that anyone needs my help, I'm out there. I'm open. Whenever I'll be available, I'll be happy to answer any kind of questions put to me.
Thank you so much. And I'll drop one feedback, and what you have learned from the session, do drop it, because every time a guest get to know how to get better and how much he has influenced you, it made him or it makes him or her do even better, you know, with each passing day. So do not forget to drop your feedbacks and what you have learned in this section. Next week, we'll be back with another guest, and we'll be talking about very trending, we'll be talking about cancers, and we have a specialist for that. So stay tuned. We'll reveal about the speaker in the weekend only. And you have anything last, if you want to say anything, Dr. Vansh?
I'll just say stay healthy, stay fit. Homeopathy heals. Thanks
Thank
for
you
this
so much.
opportunity. Thank you so much, Dr. Anand.
Thank you. Thank you
Yeah.
so much. We'll meet you next week for sure, 12 noon our time. Stay tuned. Till then, stay fit, stay healthy. Homeopathy heals.